Okay, so today we're going to do a cast for a balance brace for this patient who has instability issues. And this is the same technique I use when I cast a patient for a Richie brace or another type of ankle-foot orthotic. And the first thing we do is we start with a protective strip across the patient's foot and leg, and we'll show you the reason why later. So I secure that down with some paper tape so we don't irritate the patient's skin. So a few strips of the paper tape. And then, since we're using an STS slipper sock, we use a long plastic bag that comes with the slipper socks, and this goes right up the patient's leg. So we're going to be using an STS slipper sock. And what we do is we wet this down, and what I always do is I put a little hand soap on my hands because the fiberglass can be very tacky, and this makes everything slide nice and easy. So we'll go through the technique right now. Okay. So the slipper socks come rolled up like this. You just basically unwrap it, almost like some pizza dough. And you can see it's very, very tacky, very sticky. So I just take some hand soap and mix it on my gloves, and that makes it much easier to handle. So what we'll do is we'll unfold the whole cast. And you can see it's very sticky, so that's why using the soap is very important. And then what I do is I basically take the cast and kind of tease it up with my fingers, so then when I put it on, it'll go on nice and easy. Okay, like that. And now what I'll do is I'll wet it down with some warm water. Wring it out. And then with the blue line facing up, I put the cast over the patient's toes, and then we just cinch it over the patient's heel, and then we bring it all the way up the patient's leg, just like this. And you try to keep out any folds. And now the most important part of this is what I'm about to do now, which is I take a scissor and then I just make a little cut right on top of that strip. And I'll show you the reason why we do that in a second. So now what I'll start to do is smooth it out over the patient's feet and ankle. You want to make sure you get their ankle bones, their malleoli. And then what I'll do is I'll put the patient at 90 degrees. Okay? And if there's a few folds in the front, that's not the end of the world. So you want to try to get the patient's foot at 90 degrees to the leg. And that's particularly important if you're doing a gauntlet, which is fixed. For a Richie brace that has a hinge, it's not quite as important, although you always try to do it every time anyway. And now what I do is I just gently smooth the cast over the contour of the patient's feet. You want to get the patient's arch captured in a good neutral position with the foot at 90 degrees. And the fiberglass will get warm, so the patient will feel a nice warm feeling on their foot and ankle. Usually they like it. And then once it's molded in nicely, you can just keep the patient's foot at 90 degrees. And I do a lot of these ankle-foot orthotics for patients for many different reasons. In this case, it's for a patient who has a history of tripping and falling, which is one of the most common causes of mortality in the older population. 2014, there were 29 million falls from senior citizens that caused the healthcare system $31 billion in healthcare dollars. And it is a higher cause of mortality than heart disease, lung disease, and cancer combined in the older population. So it's an underserved, underreported problem. And patients usually don't have a problem taking a pill if they have blood pressure, but most of the time patients are resistant to putting a brace in their shoes that would prevent them from tripping and falling. So the cast is starting to get hard now. All right, and now you can see when we leave it alone, the patient's foot doesn't drop down, so we're in good shape there. So if you are having an issue with tripping and falling, most insurances that senior citizens have do cover these type of ankle-foot orthoses. And just to show you what they look like, the finished product looks like this, and it is super lightweight. It's light as a feather, and it's very easy for the patient to put on. It goes in the shoes. It has a nice padded cushion with Velcro straps. It has a fixed hinge, but it does flex, so it allows the patient's foot and ankle to bend while they're walking. Patients typically improve dramatically when they wear these in their shoes as far as their stability goes. So once the cast is dry, then I take a very simple letter opener that I got from Staples for about $1, and that's what this hole is for. So we slide the letter opener into the hole, and we basically run it up the patient's leg on top of the strip. And comes right out the top there. Okay. And we can finish that with a scissor. And it makes it nice and easy. So, here is the finished product with our cast. We see a nice 90-degree ankle. We have good contouring of the arch, okay? And this will go out to our lab, and we'll have the braces made. So, if you have any issues with tripping and falling, please let our office know.